So, you're recovering from hip replacement surgery, and you're realizing that some of those simple daily routines, well, they suddenly feel like huge challenges. And right at the top of that list for a lot of people is that very first shower. So, today, we're going to break it all down with a clear, reassuring guide to help you conquer that milestone safely and, most importantly, confidently. Let me just say, if you're feeling anxious about this, you are not alone. It is completely normal. What was once a simple, mindless task now feels like a major hurdle. But that's okay. We're going to walk through a solid plan, step by step, to help you build that confidence and get through it safely. All right, so first things first, let's change how we even think about this. Taking that first shower after surgery isn't just some challenge you have to overcome, it's a huge milestone. Seriously, it's a massive step on your road back to independence. So why does this feel so nerve-wracking? Well, it kind of boils down to a perfect storm of three things, right? Your balance is probably a little off, your movement is very restricted, and you're in what is usually the most slippery room in the entire house. That's the core problem we're here to solve. Okay, so now that we know the challenge, how do we tackle it? The answer is preparation. Before you even think about turning on that water, it is all about getting the environment right. Creating a safe space is genuinely the most important thing you can do, and it all happens before shower day even arrives. We can break this prep work down into three simple steps. First, remove hazards. This means any little throw rugs, bath mats you could slip on, any clutter on the floor, get it out of there. Second, install your safety aids, and we'll get to what those are in a second. And third, you want to position all your supplies so you don't have to reach, stretch, or twist for anything. Here it is, your showering toolkit. A shower chair or bench? This is non-negotiable. It's your stable base of operations. A non-slip mat is crucial for outside the tub for when you get out. A handheld shower head gives you control of the water, and a long-handled sponge means you don't have to bend. And of course, securely installed grab bars are your best friends. Lastly, make sure your soap, shampoo, and a towel are all right there, within easy arm's reach of your chair. Okay, deep breath. The bathroom is prepped and ready. Now it's time for the main event. In this section, we're going to go through the whole process, move by move. The name of the game here is to be slow, to be deliberate, and to be really mindful of your body with every single little action. First up, getting in. Using your walker or your crutches, I want you to back up slowly until you can feel the shower chair touching the back of your legs. Hold on, don't sit just yet. Reach back and get a nice, firm grip on the chair's arms or those grab bars. Then you can lower yourself down slowly and with total control. Once you're seated, carefully lift and swing one leg in and then the other into the tub. Now, I really want to pause here for a second because this is the golden rule. This comes straight from the American Academy of Orthopedic Surgeons, and it is the most crucial point. Whether you are sitting, standing, or moving your legs, you always want to maintain that L shape between your torso and your thigh. No bending forward. This is what protects that new hip of yours. All right, once you're in, it's time to wash. That handheld shower head is going to be your best friend. It lets you direct the water exactly where you need it without having to shift your body around. Just stay seated and use that long-handled sponge to safely wash your feet and your lower legs. And remember that golden rule. Absolutely no twisting, no reaching, and no bending forward. Getting out is pretty much just the reverse of getting in. Turn the water off. Maybe just wait a second for the drips to stop. Then, carefully swing your legs back out, one at a time, and plant them firmly on that non-slip mat you put down earlier. Now, to stand up, you're going to push up from the chair's arms, using your arm strength, not by leaning forward. Once you're up and stable, you can pat yourself dry. And there you have it. You did it. That first shower is officially done. So now let's talk about how to turn this big, one-time event into just a safe, normal habit. This is how you build confidence for the long haul, so it stops feeling like a production and starts feeling like, well, just taking a shower again. Think of this slide as your new cheat sheet. On the do side, always use your support, move slowly and with purpose, and keep that floor clear and dry. And just as important, on the don't side, never ever rush the process. Avoid twisting or breaking that 90-degree hip roll, and don't lean forward to stand up. These right here are the habits that are going to keep you safe. So I really want you to remember this. Successfully and safely taking that shower is a huge personal victory. It's not just about getting clean. It's about reclaiming a piece of your independence
and it's proof to yourself that you are absolutely on the path to a full recovery. Make sure you celebrate that win because you've earned it.
You've just conquered the shower. You've proven to yourself that you can adapt and you can overcome a serious challenge. So what's next? What's the next milestone you're going to aim for on your recovery journey? Keep that forward momentum going.